Hi, I'm Jean Schumacher, founder of Simply Plant-Based, where I have programs to help you to change your health destiny, including the Plant-Based Academy, where I provide help, support, guidance, and resources to switch to a plant-based lifestyle, as well as the Pregnancy Advantage, where Dr. Deborah Shapiro, OBGYN, she and I help women to get their bodies pregnant ready or help heal your bodies if dealing with infertility issues. Today, I have the honor of connecting with Dr. Lee Ettinger, who's a board-certified pediatric nephrologist and obesity medicine, and is a specialist in hypertension. Thank you so much for taking the time to meet with me here today.
Thanks a lot for having me. I'm really excited for our conversation.
Oh, it's a good one. This conversation that we're about to have is based upon the article in the American Journal of Lifestyle Medicine, of which you are one of the authors, and it's titled Plant-Based Diets and Hypertension. So let's talk about kidney disease and what are some of the issues. Because chronic kidney disease can bring a whole host of complications. I mean, for example, metabolic acidosis. So let's start right here and unpack that. What is metabolic acidosis?
So our bodies like to maintain a nice normal pH around 7.2, 7.3, 7.4, which is slightly alkalotic, more like a base. But our metabolism, our digestion of our food, the waste that comes out of our muscles as we're using them, things that are breaking down and turn over in our body, all produce acids. And the main way that we excrete those acids is through our urine. And it's our kidney's job to unload all that excess acid that builds up just from normal day-to-day eating and living. But when you have chronic kidney disease, the kidneys don't excrete that acid load as well, and the acids build up in your body, and that can be bad for you in several different ways. For example, in pediatrics, a child with chronic kidney disease with acidosis, has a decreased appetite. And so might not be eating as well and might not grow as well. An adult or an elderly person with a decreased appetite also might have unwanted weight loss and become malnourished, for example. And at extremes, for example, when someone's getting ready for dialysis, there's so much acidosis in their body that they might even take it the next step as to eating less to actually being nauseated or vomiting. And if you think about it, this is actually the smart kidney kind of sending a signal or controlling the body and saying, look, I can't do my job. I can't get rid of the acids. So I'm going to cut down on food coming into the body because that's a major load of acid. So the kidney is kind of selfishly saying, I can't do my job so well, so stop stressing me out. But for the rest of the body, you need nourishment and you need nutrition. So that's one of the ways that the kidney sometimes acts selfishly to the detriment of the rest of the body. So that might be an indication it's time for that kidney to go, either in the form of a kidney transplant or dialysis to help manage the acid balance in the body.
So are there other complications from chronic kidney disease?
Right. The kidney has very many great important roles in the body. For one, it stimulates and sends message to the bone marrow to make new red blood cells. And so when that kidney failure is occurring and we don't get that message anymore, someone can easily develop anemia, and that will make them feel weak and tired. Someone who has chronic kidney disease also will develop increasing amounts of urea. And urea is a protein breakdown products that build up in the bloodstream. They're supposed to go out in the urine, but if the kidney isn't working as well, they will build up in the body. And they have the urea and similar kind of molecules have several deleterious effects on the body. They'll make you feel tired. They can cause confusion and memory problems and concentration problems. And so when I was working with my patients who are kids who are progressing through chronic kidney disease, I'd always want to know what their grades were. So that was a good indication to me as to how their concentration was and how their memory was doing. Were they starting to have problems of the kidney not being able to handle this protein waste and giving them school problems, academic problems. I remember I had one young family where the mom was like, oh, he's getting D's. And I was like, oh, really? And she's like, oh, but he always gets D's. So it wasn't a decline per se for him, is what the mom was trying to say. But sure enough, after he got his kidney transplant, he was getting A's and B's. So there might have been some cognitive problems from the waste products building up in his body. But I remember being alarmed by this, but mom didn't seem to be, because it wasn't an acute change.
But a
And
consistent one along the way.
yeah, that's what I was looking for, was change. But he was kind of maybe suffering from the buildup of waste in his body. So I should also, since I mentioned protein waste, I should also say there's this myth out there that too much protein will cause kidney disease. And I think what has happened is that an adult, for example, who is progressing towards kidney disease, that protein breakdown from the foods that they're eating will contribute to a higher and higher urea level, which will give them more and more of these symptoms. So the adult kidney doctor, as they are taking care of someone who's progressing towards kidney failure, will say, you should cut back on the protein you're eating, because we would want to avoid those side effects of too much protein waste buildup in your body. So sometimes it seems people leave the doctor's office and they think, oh, the protein is causing my kidney problem, and if I cut back on my protein, then that won't give me as much kidney problem. But it's more like a side effect, that the kidney problem is the kidney problem, and that is causing too much protein waste buildup. So, and that's what causes the symptoms, because the kidney problem itself isn't causing the symptoms, but the buildup of the protein waste is. So that's why the doctor says cut back on your protein intake to the adults patients.
Aren't Americans eating way too much protein?
Yes, yeah.
I mean, and because you don't store, you only store a certain amount, and then the rest of it has to get excreted. And so you're putting a phenomenal stress on your kidneys, right?
Yeah, the typical American diet is 2 to 3 times the amount of protein that we need. And you're right, that protein is not stored. Too much sugar, too much carbohydrates, too much fat does get stored in the body, but too much protein gets urinated out, which, to be honest with you, I think is the appeal of the low carb or the high protein diets, is that you can encourage someone to eat a lot of protein and help them lose weight, because they're replacing the fats and sugars and carbohydrates in their diet with the protein, which is just going to be urinated out. I kind of think that protein is more the empty calorie, because if you eat too much carbs or eat too much fat, it's going to get stored. But if you eat too much protein, it's going to be urinated out. People are flushing a lot of the protein that they're eating down the toilet. So that makes me think it's more like an empty calorie than some of these other macronutrients. But yeah, the typical American is eating way too much protein. But I think people get kind of mishear or misunderstand when they're told they have kidney disease and to cut back on the protein. It's not that the protein is harming the kidney. The protein breakdown products are what's going to eventually cause the symptoms of the kidney failure. Another complicating message is that several kidney diseases have protein in the urine. There should be no protein in the urine, but a lot of kidney diseases cause protein to appear in the urine because the filters that are supposed to keep the protein in the bloodstream are damaged, and the protein in the urine. So the doctor will also give a medicine like the previously mentioned ACE inhibitor or ARBs, which will decrease the protein coming out in the urine. So, people get the message, or they might think that, I'm eating the protein and the protein's coming out my urine, and now this medicine is going to help my kidneys by taking care of that problem. But again, it's not that the protein you ate too much protein and that's why it appeared in the urine. It's just that a sign that there's a problem in the filters of the kidney allowing the protein to come out. The reason why the doctor wants to decrease the protein coming out, because the protein is both a sign of a problem at the filters of the kidney. There should be no protein in the tubes, and the protein in the tubes does damage the tubes of the kidney. So we want to lower the protein coming out in the tubes of the kidney. That helps us protect the tubes of the kidney from the protein that shouldn't be there in the first place. But the protein's not there because you ate too much. The protein's there because you got holes in your filters, holes in the filters of the kidneys because of the kidney disease. The volume of your urine is not a reflection of your degree of kidney disease until it's zero, until you're zero. So we talk about people with kidney disease might be talking to their doctor about their GFR, their glomerular filtration rate. So that's the volume of blood that's cleaned per minute.
Mhm.
And if you start your life with 100%, you're going to be needing renal replacement therapy, which is dialysis or a kidney transplant when you get down to about 15%, 1-5. Even if you have 15 milliliters of urine per minute over the course of the day, you're still going to be able to make many liters of urine. Even if you have 1 milliliter per minute of blood cleaned, you're still going to be able to make 1.4 liters of urine per day. And there are people on dialysis who still make urine. It's only when that volume goes down to zero that you know you've lost all kidney function. You can have very minimal kidney function and still be making regular amounts of urine.
So, in terms of chronic kidney disease, what about hypertension?
Yeah, that's a way, again, that the kidney is acting selfishly. So as the kidney starts to develop disease and can't do its job as efficiently, it sends a message to the heart and says, hey, give me more blood, pump harder. I'm kind of struggling here. I need to do my job to clean the blood. And so there are hormonal messages that go to the heart so that the kidney thinks it can just like work harder to make up for the poor job that it's doing cleaning the blood in stage 1, stage 2, stage 3 kidney disease. And the heart says, okay, I'll oblige. And we measure high blood pressure in the arm. But again, this is the kidney acting selfishly, trying to do its job better with more blood, whereas the high blood pressure is affecting other parts of the body, as we discussed, and even damaging the kidneys more. The healthy remaining kidney tissue can be damaged by all that high blood pressure. So this is why we can sometimes see even an acceleration of kidney disease as someone goes from stage 1 to stage 2 to stage 3 to stage 4. The failing kidney is just asking for more and more blood. There's more and more hypertension, and unfortunately that accelerates the process. And so, yeah, it's important to lower blood pressure in chronic kidney disease because, well, we can replace the kidney. That selfish kidney can be replaced with a dialysis machine. It could be replaced with a healthy kidney. We can't replace the other organs that are being damaged by the high blood pressure, like the brain and the heart as easily. So sometimes we don't want the kidney to get the satisfaction of its extra blood flow and, in a way, lower the blood pressure to protect the rest of the kidney while trying to manage the kidney disease. So yeah, any study that's going to show improved blood pressure in someone with chronic kidney disease is going to hopefully slow the progression of that kidney disease while also protecting the rest of the body. So there was a trial that did show that the effects of fruits and vegetables in stage 1 and stage 2 chronic kidney disease, that 2 to 4 cups of fruits and vegetables per day were able to significantly lower blood pressure when compared to controls who did not receive the fruits and vegetables. So
Grandma was right. Eat your fruits and vegetables.
Eat your fruits, yes. Eat your vegetables.
Well, and if you do have the internal locus to want that change, then you're going to need help and support because you're going to have a lot of questions because you're going to be changing your lifestyle. I mean, everything that you've learned for the last however many years you've been on the planet, you're going to be changing that. And so you're going to need help. And so I've created the Plant-Based Academy to help people and provide that support and coaching and education. And I know that you offer as well. So share with us what you offer.
Right. So I worked in my hospital in the major medical center in a pediatric weight management program. And I've since left and developed my own pediatric weight management program. Again, for people with an internal locus of control who want to learn how to eat healthier and eat more plant-based. And so I offer a 12-week program with the support of telemedicine visits with an e-course so that you can learn at home. And I've also coordinated with a plant-based chef so that there are virtual cooking classes to your own kitchen, and also a youth fitness expert. She can meet families online and do a virtual exercise classes depending on what the child's interest is, whether that's getting strength or conditioning or flexibility, things like that. So in that very comprehensive and supportive 12-week program, I'm helping someone, hopefully a family with an internal locus of control who really want to learn how to take these steps. And then another program that I offer is a 4-week pediatric nutrition optimization program. Because what I've been frustrated by is a lot of families that I work with, both when I was in the nephrology department and in the obesity management programs, is that the pediatricians would kind of be getting counter advice. So I'd see a family and they say, oh, I developed anemia. My pediatrician said I should eat more meat, or, oh, I need dairy every day. And so what I really want to help support, or families that were vegan or vegetarian or trying different variations of pescatarian, the plant-based diet, that they were getting a lot of concern from their pediatricians or from other family members or friends as they were raising a child. And so I developed a 4-week program also to help support families to understand nutrition and to avoid deficiencies and to meet all of these concerns and have kind of a response for all these concerns, protein, iron, things like that. So that's a 4-week program, again, all telemedicine with its own separate e-course. And that one's working with the plant-based chef also to learn new recipes and to really give someone a nutrition education and a nutrition mastery. So you go through the 4-week program and then you take that hopefully for the rest of your life. Again, for someone who's very internally motivated, they've learned how to fix their problems with my support. I'm only licensed in New York and New Jersey at this moment, so I'm also offering the e-courses more widely to anyone online who wants to sit down and go through the e-course. It's just when you're working with me one-on-one, then we go through it with more support, more details. But the e-courses are also standalone for people.
Excellent. Excellent. Thank you.
Thank you.